Hello, everyone. I'm Gail Davis, Provost and Vice President for Academic and Student Affairs here, and a former faculty member of Women's Studies, Women's History, and so on. So I am doubly delighted to be here and happy that we're sponsoring this program. Thank you to all of you, and thank you, Gretchen, for the nice introduction. It's really going to be the best of all pleasures to introduce Dr. Beatrice Huffman to you. She is a leading historian of U.S. healthcare systems. I bet you have been very busy during this political season, Beatrice, with the debate about what's best in healthcare, what's best in healthcare insurance, what's best for women's healthcare rights being in the air everywhere you look these days. So as a person addicted both to politics and an academic in women's history, and I'm sure all of us are really looking forward to the presentation. So thanks for being here. You couldn't be in a better town for this talk either, since much of Grand Rapids, including Grand Valley State, has been very highly invested in the healthcare industry, hoping to develop stellar health education, research, innovation in practice, all in the quest for great healthcare here. I hope some of the visitors to town will be able to see what we call Health Hill on Michigan, where so much of the investment in medical health-related work has been made. Dr. Hoffman is professor and chair of the Department of History at Northern Illinois in DeKalb, Illinois. She completed her PhD, as it seems everyone at my table did, at Rutgers University in 1996. She's written extensively on the history of American healthcare reform, including a 2001 book entitled The Wages of Sickness, The Politics of Health Insurance in Progressive America, that the University of North Carolina Press put out. In her talk today, though, she's going to speak about her latest book. That book's title is Healthcare for Some. Aha, I have a feeling it's going to be applicable to our times. The talk is entitled Healthcare for All, Women, Activism, and the Human Rights to Health. This is a history, her book rather, and her talk today will be partly the history of rights and rationing in the United States from the Great Depression to the present. And the book just came out this month by the University of Chicago Press. I've seen copies of it flying around, so I wish I had one to hold up here. By all accounts, Dr. Hoffman has simply nailed this big historical topic up to the present moment. I'm going to read a few blurbs from the early reviews of the book just to give you a sense of how that is being received. T.R. Reid, who's author of The Healing of America, writes this: in the American political debate, everybody condemns the notion of rationing healthcare. But Beatrice Hoffman's meticulous history shows that rationing by income, age, employment, etc., has been and remains a central element of America's medical system. She demonstrates that our various attempts at reform over the decades have kept the rationing mechanisms firmly in place. So I wonder, do you think she'll talk about death panels too? I don't know. But Jonathan Oberlander, who's author of The Political Life of Medicare, writes this. Excuse me, my allergies are showing up this morning. Beatrice Huffman skillfully chronicles America's struggles to make healthcare a right from the Depression through Obamacare. Hoffman's beautifully written account explores the pervasive rationing of medical care and insurance in our staggeringly unequal health system. Healthcare for Some is a compelling reminder of how far we've come, but also how far reform still has to go in the United States. The reviews keep this tone throughout. Beautifully written, insightfully described, and thoroughly researched. This book is a must-read, sounds like to me. Thank you so much for your work. I know we are all in for a treat right now, so let me get out of the way and join me, please, in welcoming Dr. Hoffman to the stage.
Thank you so much for that really kind introduction. I'm honored. And again, I want to thank the conference organizers for inviting me to be here today. In July of 1938, the Roosevelt administration organized a national conference on health care reform. The Great Depression had been going on for nearly a decade. FDR had signed the Social Security Act and the Fair Labor Standards Act into law, but the United States still had no national program for addressing the health needs of the people. The 1938 Health Conference was the beginning of something different. Instead of inviting only doctors to speak, the conference for the first time included members of labor unions, farm groups, and civil rights organizations. It included representatives not just of the medical profession, but of the people who needed and used health care. That summer, a woman named Florence Greenberg traveled from Chicago, Illinois, to Washington to offer her testimony. Greenberg was a member of the Women's Auxiliary of the Steelworkers Organizing Committee, spending her days working in the communities around Chicago's steel mills. Greenberg told the audience at the National Health Conference that she had come to offer them a different picture of Chicago. Just steps away from the comfortable headquarters of the American Medical Association was a Chicago of dirt, filth, and tenements, a sick Chicago where people struggled with terrible health conditions related to poverty and unemployment and struggled to obtain basic medical care. Greenberg told the conference of the grossly overcrowded Cook County Hospital, the city's only public hospital, which locals described as a death house. A single overcrowded private hospital served the entire African American community of the South Side. Chicago's outpatient clinics were filled to bursting. Greenberg spoke of people who were too sick to leave their homes but couldn't get a doctor to visit them, or who couldn't afford the few pennies for transportation to a clinic. She told the audience about a child with double pneumonia who had died of an abscessed lung after being turned out of a hospital because the relief agency would no longer pay for her care. And on behalf of the working people of Chicago, Florence Greenberg made the following demand. We're asking our government to take health from the list of luxuries to be bought only with money and add it to the list containing the inalienable rights of every citizen. We don't know whether Franklin Roosevelt ever heard about Florence Greenberg's unprecedented call for health care as a right, because even though he had endorsed the conference, he chose that time to go on vacation. FDR was actually on a cruise. I guess we can't really blame him. It's probably a pretty well-deserved vacation. But 3 years earlier, FDR had refused to include medical coverage as part of the Social Security Act because he did not want to antagonize the American medical profession. He did send a message of support to the health conference, but not long afterward, the outbreak of World War II forced the president's attention elsewhere. 5 years later, on January the 11th, 1944, in his State of the Union address, Roosevelt spoke to the American people about the war, and especially about the kind of peace the Allies planned to establish after the defeat of fascism. He said that the one supreme objective for the future can be summed up in one word: security. And that means not only physical security, which provides safety from attacks by aggressors, it means also economic security and social security. The individual political rights upon which the United States had been built, Roosevelt argued, were necessary but not sufficient to guarantee true freedom and security. FDR then announced an economic Bill of Rights, which is sometimes called the Second Bill of Rights, that included the right to a job and a living wage,